Calculate Vertebral Heart Score, VHS, in dogs. Professor Dr. Sanjay Purohit. Vertebral Heart Score, VHS, is a measurement technique used to evaluate the size of the heart relative to the vertebral column on a lateral thoracic radiograph. It is simple, non-invasive way to assess heart size and monitoring cardiac health in dogs. It should always be used in conjunction with other diagnostic methods and breed-specific references to ensure accurate interpretation and optimal patient care. Common cardiac disease in dogs: congestive heart failure, CHF, dilated cardiomyopathy, DCM, valvular disease, heartworm disease. Clinical signs of heart disease: exercise intolerance, coughing, difficulty breathing, weight loss, lethargy. How to calculate the vertebral heart score: obtain a lateral thoracic radiograph. A right or left lateral thoracic X-ray of the dog should be taken, showing the side view of the heart and vertebrae. Using a lateral thoracic radiograph, ensure the thoracic vertebrae T4 to T12 are clearly delineated. Dog must be placed in a lateral recumbency. Tape the thoracic limbs together evenly and pull cranially. Tape the pelvic limbs together evenly and pull caudally. Avoid rotation or tilting of the dog's thorax, as this can distort the heart's appearance. Foam wedge may be placed under the elbow joints and/or sternum in order to maintain laterality of the patient. Wedges are typically needed for large breed and/or barrel-chested dogs. Thoracic spine should be aligned with the horizontal line of the collimated field of view. Dog should be at the end of exhalation to avoid changes in the heart's position or size due to lung inflation. Ensure the thoracic vertebrae T4 and heart in radiograph. Measure the long axis of the heart. Using calipers, the longest axis is measured from the carina, the point where the trachea divides into the bronchi, to the apex, the most caudal point of the heart. This line is drawn and its length, L, is measured. Transfer this long axis measurement to the vertebrae, starting at the cranial edge of T4, and count the number of vertebrae that fall within the caliper points. C. Measure the short axis of the heart. Using calipers, the short axis is measured perpendicular to the long axis, typically at the widest part of the heart, usually at the level of the caudal vena cava. Designated S. This line is also drawn and measured. Transfer this short axis measurement to the vertebrae, starting at the cranial edge of T4, and count the number of vertebrae that fall within the caliper points. Calculate the VHS. VHS equals heart length, L, plus heart width, S, vertebral units, 5.3 plus 4.5 equals 9.8 VHS. Vertebral heart size, VHS, for dogs: VHS above the normal range up to interpretation +1 mild enlargement +2 moderate enlargement +3 marked enlargement above +4 extreme enlargement. Vertebral heart score, VHS, normal values for various breed of dogs. Factors affecting VHS accuracy: age and breed variability. Older dogs may have naturally larger hearts. Some breeds, for example, Dobermans, Boxers, have slightly larger normal hearts. Body condition: overweight dogs may appear to have a larger heart due to fat around the thoracic cavity, affecting VHS measurements. Radiographic quality: poor quality X-rays can distort measurements. Overexposure or underexposure can blur heart borders or vertebral markings. Clinical interpretation: A higher VHS suggest cardiomegaly, enlarged heart. 1 mitral valve disease, MVD. VHS can help to detect the early signs of left atrial and ventricular enlargement, which are characteristic of MVD. Regular VHS measurements can be used to track heart size changes, guiding adjustments in medications such as ACE inhibitors, diuretics, or pimobendan. 2. Dilated cardiomyopathy, DCM. Enlarged heart due to dilation of the ventricles. High VHS can help to confirm suspicions. Regular VHS measurements are valuable for assessing response to medications, for example, pimobendan, ACE inhibitors, beta blockers, and for determining when to initiate or adjust therapy. 3. Congestive heart failure, CHF. In dogs presenting with respiratory distress, coughing, or exercise intolerance, an elevated VHS can indicate cardiomegaly due to CHF. Serial VHS evaluations help assess the effectiveness of treatment, for example, diuretics, vasodilators, in reducing heart size and managing clinical signs. 4. Pericardial effusion. Accumulation of fluid within the pericardial sac can cause an enlarged cardiac silhouette on radiographs. VHS can be significantly elevated due to the increased size of the heart shadow. This should prompt further investigation via echocardiography or pericardiocentesis, removal of fluid. 5. Congenital heart diseases, conditions like patent ductus arteriosus, PDA, aortic stenosis, or ventricular septal defects can cause cardiac enlargement. In puppies or young dogs with congenital heart murmurs, an elevated VHS may suggest the need for further diagnostics. The lower VHS. Rare, but could indicate underfilled or small hearts due to shock, dehydration, or other conditions. See normal VHS. VHS within the breed-specific range suggests that the heart size is within normal limits. However, it does not rule out all cardiac diseases. Some conditions, like arrhythmias or mild heart failure, might not cause significant changes in heart size. Common questions about VHS-Q. Is VHS a perfect diagnostic tool? No, VHS is a screening tool and should be confirmed with additional diagnostic tests like echocardiography. Can a dog have a normal VHS but still have heart disease? Yes, early stages of heart disease may not cause significant heart enlargement, meaning VHS may still be normal. Thanks for watching this video. You are requested to like, comments, share this video and subscribe.